Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today I will discuss another important topic of dermatology. The name of topic is congenital erythropoietic porphyria. Hopefully you will learn and subscribe my YouTube channel. Definition: it's a severe and rare childhood porphyria causing long life, multi-radiating photosensitivity and hematological disease. It is also known as the Gunther disease. Pathophysiology: it is autosomal recessive disorder caused by inherited deficiency of uroporphyrinogen 3 co-synthase enzyme. Leads to formation of type 1 isomer which does not participate in heme formation and accumulate in erythroid cells. Clinical presentation: these include brown discoloration of amniotic fluid noted at the time of labor. This is usually noted by the mother. Pink or brown porphyrin staining of nappies. Photosensitivity. Blister on light exposed part of body. Fragile skin. Scarring on face, hand with hypo and hyperpigmentation. Pseudosclerodermic changes and microstomia are the important clinical features. Other clinical features are eye features, which are usually keratoconjunctivitis, blepharitis, cataract formation, corneal ulcers, scars, cicatricial ectropion, scarring alopecia of eyelid. When teeth emerge, they are usually brown in color. Decreased bone density, osteopenia, osteolytic lesion on X-ray, resorption of terminal phalanges, acroosteolysis, cortical bone rarefaction, and hemolytic anemia are usually observed. In picture A, you can see the scarring of face. Scarring is usually patchy. There is also hypo and hyperpigmentation of face, neck, and forehead area. You can also note the hypertrichosis, which is usually noted in congenital erythropoietic porphyria. There is also pseudosclerodermic changes of skin. You can also see the erosion and resorption of ears. In picture B, you can also see the similar changes, but here microstomia is clearly observed. There is pseudosclerodermic changes and involvement of eye. The main clinical features of eye are keratoconjunctivitis, cataract formation, blepharitis, and scarring alopecia of eyelashes. Always note that the exposed part of the body, for example face, ear, nose, and upper part of neck, hands are usually involved. This picture describes the pseudosclerodermic changes of hands. You can note here the fixed flexion of proximal fingers. This is due to pseudosclerodermic changes. The X-ray of this patient usually shows bone resorption and decreased bone density and osteolytic lesion on X-ray. There is also a hypo and hyperpigmentation which can be seen in this image. There is also osteolysis of nails. Differential diagnosis include epidermolysis bullosa dystrophica, hereditary erythropoietic porphyria, variegate porphyria, and porphyria cutina tarda. Investigation: uroporphyrinogen 3 co-synthase enzyme. This is the most important enzyme which is usually deficient in congenital erythropoietic porphyria. RBC and urine contain uro and coproporphyrin. This is the second line investigation. And feces contain coproporphyrin, mainly type 1. Plasma spectrophlorometry peak is seen at 615 to 620 nanometer. Normal level of 5 carboxylic acid porphyrin excretion in feces is another important investigation. Now management. Avoid sun exposure by protective clothing and hats. Sunscreen containing zinc oxide, titanium oxide with added iron must be used. Use of umber window film for home cars are usually applied. Treat secondary infection. Hypertransfusion of blood to suppress erythropoiesis. Here, hypertransfusion indirectly suppress erythropoiesis because when erythropoiesis is there will be always defective hemoglobin. Another management option is the IV hematine, splenectomy, and bone marrow transplantation and gene therapy are the management option. Thank you very much. Stay connected and subscribe my YouTube channel.